Ivan Chan runs a small family restaurant in Halifax. Even though government regulations don't require it, he's decided to close his dining room and offer takeout only.
I get a little nervous, I would say, with all those cases and exposure locations that you see in the news every day.
Today, Newfoundland and Labrador and Prince Edward Island decided they're getting nervous too, pulling out of the Atlantic bubble at least for 2 weeks.
I've said before that COVID-19 is knocking at our door, and in recent days that knocking has become louder and stronger.
Since July, Atlantic Canadians have been able to travel within the region without isolating for 14 days, as is required for the rest of Canada. The low case count had become a source of pride. Today, Newfoundland and Labrador says leaving the bubble is a preventative measure to avoid a full lockdown.
For weeks now, we have watched as the second wave of COVID-19 has gained traction and built momentum across the mainland. It felt like it was just a matter of time before it made its way east, and it has.
In Nova Scotia, health officials now say there is community spread. New Brunswick announced another death today. But both provinces are technically still in the bubble, or what's left of it. Islanders can visit those provinces, but they'll still have to isolate when they return home.
I'm sad. I'm from Nova Scotia, so if it stays burst, then I won't be able to go home for Christmas.
I think it's probably for the best at the moment to just stick to where we are, just to keep everyone safer across the bubble, and maybe in the future we can go back to the way we were.
Governments say they'll reassess the bubble's viability in 2 weeks.
As soon as everybody is doing their part, like we have been in Nova Scotia, I really think we can, this time would be passed.
Chan hopes his temporary sacrifice will help get things back under control.
So Kayla, I guess bottom line, does this mean that the bubble failed?
It's an interesting question, Adrienne. I mean, the Atlantic region has been the envy of the rest of Canada and beyond. We've reported on people who want to move here, and it has been working. I mean, for more than 4 months now, other than wearing masks, for many here, life has been pretty normal. But I think it's important to remember that officials have always said it might not work forever and that they wouldn't be able to keep the virus out completely. Adrienne.
All right, hang in. Kayla Hounsell in Halifax. Thanks, Kayla.
Now, joining us from Halifax is infectious diseases specialist Dr. Lisa Barrett. And Dr. Barrett, for anyone not living in Atlantic Canada, the numbers will seem quite small, right? P.E.I. in single digits, Newfoundland and Labrador in the dozens. I get that the populations are smaller, but what is the primary concern here?
Obviously, New Brunswick and Nova Scotia have higher numbers, and P.E.I. and Newfoundland are well aware that asymptomatic spread is a big deal. They do not want to bring more cases into their province because that's how you start to have uncontrolled spread when you have such low numbers. And they've decided to take a very aggressive action to keep things closed for a little while, which is a great leadership move, especially from a virologic and infectious disease perspective.
Okay, but then why wouldn't Nova Scotia and New Brunswick sort of sever their connections? Why keep that bubble intact?
We have similar numbers in New Brunswick and Nova Scotia. We're very connected in a workforce and border perspective. And so really the answer in our populations is to make sure that we're testing more so we know where people are and when they're positive so we can help them to isolate when they need to. Better than closing our bubbles to each other is to make sure that we know who's positive with additional testing.
Okay, that's helpful. Dr. Barrett, thank you so much.
Thank you.